Your program, for me, it's like nursing. We see the human body holistically, not just targeting organs.
Yeah.
I told you I was diagnosed to have celiac 2 years ago, but I was in denial because my doctor said, well, your biopsy just showed a little bit of reactivity to celiac, so I'm not going to be really worried about it. So I didn't feel worried about it until I got really sick and found your program. Like, damn, I should have really listened to that.
I'm Maggie, UMD, functional and holistic medicine and owner of Transform. If you haven't joined our Facebook group, Transform Autoimmune Disease Naturally, go ahead and click the link and join that group right now. If you are on YouTube watching this, make sure you subscribe and give us a thumbs up on this video. And if you're on Instagram, give us a follow. Today, we have an interview with a nurse, Katrina, who's been dealing with celiac and tons of other autoimmune issues, related issues such as allergies, asthma, sinusitis, degenerative joint disease, neuropathy, digestive issues, you name it. A lot of people think having one autoimmune disease like celiac means that you only have one target of autoimmune attack. But the truth of the matter is there's many other targets of autoimmune attack that's linked with the autoimmunity. I'd love for you to see how this one nurse tackled this problem and solved it. Hey, Katrina, why don't you introduce yourself?
Hey, Dr. Maggie. Hi, everyone. My name is Katrina, and I have been diagnosed to have celiac disease, asthma for about 2 years. I also have gastric reflux on top of that. And just recently, the beginning of the year, I was diagnosed to have degenerative disc disease, which I have neuropathy on these 2 fingers and constant pain on my neck and shoulder.
So neuropathy and pain, those are some other symptoms. So it sounds like even though you have your official one diagnosis for autoimmune disease is celiac, you have many other targets of autoimmune attack and many other symptoms.
Yes.
Okay. So Katrina, what do you think were some of your biggest frustrations around the approach to your health prior to joining our program? What were some of the problems?
Well, the problems came gradually and they just started mounting up. And seeing my PCP, they're just shoving me these medications and there was no really clear process as how I can cure myself of it.
Yeah.
So, and finally, when I had the pain on my neck, they did an MRI and they found out that I had a degenerative disc disease, specifically my C4 and C5. And there was a bulge on that disc that they found out and they wanted to do an invasive procedure. I'm like, nope. So finally decided I needed to do something for my health.
What were your frustrations like? So it sounds like surgery was your only option for some of the pain issues. And then what about all the other issues like the GERD, the hiatal hernia, the
omeprazole?
Like
they just pushed me on medications.
So your frustration was medication.
Mm-hmm.
Did the medications work? Did they
temporarily?
Help? Yeah.
Temporarily.
Okay. But if they helped, then why were you frustrated?
Because I was getting sicker and sicker. I was getting tired of getting sick.
And are you currently working?
Yes, I work as a nurse at the hospital.
Yeah, and is there an extra layer of frustration being a healthcare provider who knows?
Exactly.
And I'm a doctor,
exactly.
You're a nurse. Were there an extra level of frustration with the kind of healthcare you were receiving and doling out?
Very much.
How so?
A lot of frustrations.
How so?
Well, being in the healthcare field, a little bit of these, I've taken care of these kind of patients, right? And just looking at them, and it's like looking at myself in a few years after, if I don't manage my health right now, and looking at them and they say, well, I've been having this kind of problem for like 10, 20 years, and they're not getting any better. They're getting sicker. Like, I don't want to go down that route.
Well, and we see doctors and nurses go through the same thing, and they're the one doling out these meds, and they're getting sicker, fatter, sicker, and madder also.
Yes.
You're graduating our 2-month online program, Transform. I want to know where your symptoms are right now. This is just 2 months later.
For pain, from 7 to 8, I am now 2 to 3. Whoa. Today, I'm a 1. So that's a huge, huge change. Also, for my gastric reflux, I've been off my omeprazole. Well, ever since I started the program, I just cut cold turkey. And I'm off of my Symbicort for my asthma, and I'm off of my cetirizine for my allergies. So I've completely cut that off, taking the digestive enzymes, the Sinoplex, and has done great wonders. Like I can feel the change inside my body.
What you're saying right now is impossible for medical providers out there to believe is real.
Yes. Like they have to know the program.
This is blasphemy.
I
What?
know.
Katrina, you're not taking my meds. You're not doing this inhaler. You're not still sick. This is blasphemy. So what do you think was so different about this program and what you did while working with us the last 2 months that's very different than everything you've ever done?
I'm not saying anything bad about medical practitioners out there, but we also have to consider that there is a lot of options that we can look. And your program has helped me that, because your program for me, it's like nursing. We see the human body holistically, not just targeting organs.
Yeah.
So that has been my greatest takeaway from this program.
What were the 3 most impactful things?
Number 1 is mindset for me. Yes. I told you I was diagnosed to have celiac 2 years ago, but I was in denial because my doctor said, well, your biopsy just showed a little bit of reactivity to celiac, so I'm not going to be really worried about it. So I didn't feel worried about it until I got really sick and found your program. Like, damn, I should have really listened to that.
You felt like mindset work was huge in just being able to think more bigger, thinking bigger.
Bigger and cementing like my drive that I really need to do this for my health. Like I'm not going to cheat, because I used to cheat before. I was in a lot of, diet programs, but I cheated from eating, pastries and all that.
It's not that bad. I can cheat.
Mm-hmm. Yes, exactly. Number 2 is blood sugar.
Blood sugar?
Huge.
Really?
Huge.
Didn't you have
Huge
that licked?
difference.
Didn't you know about blood sugar and didn't you have it licked?
The only thing that I knew about blood sugar as a nurse is whether you're diabetic or not.
Exactly.
That's
Ding, 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 ding. And that has nothing to do with what we're talking about, which is blood sugar mastery.
And my blood sugar overall, they're normal.
I know.
But I was having the effects that I didn't know before was related to my blood sugar.
And I think this is a really big point, because if people haven't joined our Facebook group, in our Facebook group and on my YouTube channel, I literally have at least 20, 30 videos around how blood sugar is literally tied to every symptom in autoimmunity. And it's not just about high blood sugar at all and whether you're diabetic or not. It's about what the hell is blood sugar mastery as one of the major triggers of autoimmune attack. So you felt like mastering your blood sugar, what do you think was some of the tangible results that happened almost immediately for you?
Eating all 3, fat, fiber, protein, balancing them in every meal and snacks that I was eating. Brain fog, like literally I couldn't feel the brain fog anymore.
People keep talking about brain fog and I'm like, what brain fog? Like we can end this in days, people. When you're saying 7 to 8 level pain every single day for years, and now it's at level 1 today, that's not from taking a drug or an opioid. That's not from anything except blood sugar mastery. Mm-hmm. And within days of it, pain level actually starts to go down.
Yes. Number 3 is food mapping. Yeah. Immediately after I eliminated all my food intolerances, gut just calmed down.
When you say that and you have that result, everybody's going to go out and say, I'm going to go and mail order some food sensitivity testing. I'm going to go ask my doctor for some food sensitivity testing. I mean, what's so different about our process for food mapping that was able to give you these results?
Your answers and your data were just spot on. I tried other food sensitivity testing with other companies, and I was just given a box, did the testing, gave them your results. Nobody explained to me what I was looking at. Like, okay, they're my results. What am I going to do with it?
And they weren't even right. That's the thing that really bothers me. If you actually compare the data that we provided you and the training that we provided you and the guidance, it is nothing compared to any other testing you've ever done. Because for me, I really do feel that I do know that people in the autoimmune population have really highly triggered or burned out immune systems. Therefore, they got tons of false positive and false negative. So even if they did a good test, which is rare, most tests suck, But even if you did a good test, you can still apply, and you've seen it in our program, all these false positives and negatives. And I'm able to say, that's a false positive, that's a false negative, and be able to just have exact, right, correct data for each person personally. I think that makes a huge difference,
Very huge. It did for me.
All right. What's your favorite thing about working with me?
Your good vibe. Always that positive attitude. I remember probably first week of mastermind, and I did something, said something negative, like, no negative thoughts here.
What's that automatic negative thought? That's going away, Katrina. That's going away. What would you say would be a reason that you almost didn't join this program?
Fear of the unknown, reliability, and too costly. So, but for me, it's worth every penny.
Why?
Because it works. 2 months and results are like really drastic for the positive.
Yeah. And these are lifelong results. And the
Yes.
interesting thing is, like what you mentioned was being able to run, being able to play with your children, being able to have
Yes.
level 1. What kind of impact has that had on your life?
Like I just have more time with them, especially I'm homeschooling.
Yeah.
It's like, I know I'm at home, I know I'm with them, but it seems like my brain and my body, because it was just into so much pain, that I wasn't really there.
Yeah.
But now I'm more engaged. And my husband has noticed it too, because usually in the afternoons he would see me often take a nap break, because the brain fog sets in. And that has really gone down. So I can now avoid eating any kind of pastries. I have that mindset and self-discipline to not cheat.
It's not worth it.
Not worth it. Not worth it at all.
But my question then is, when you look at the investment in hindsight, is this an expensive investment?
I would say just enough compared to going down the route of year after year without getting definitive, results and data, and not even feeling better in the process.
You had a question why you almost didn't join was you said you didn't know if you could rely on it, reliability. Someone else out there is saying, how do I know this works? What are you going to say about that? How would you answer that person?
Because it shows in the results. This program is data and result driven, data result oriented.
Why should they believe you that it works?
Because it works for me. I can feel it in my body.
What is something right now that you can do effortlessly that 2 months ago you would have thought was impossible?
Eating a lot of fruits and vegetables and not eating and not being tempted to eat all the junk out there.
So you've really, a lot of people really sometimes feel like when they get the data, am I going to be able to do that? And one of the things I'm hearing from you is you've gotten the education and the confidence, and you also have the results to show you that it's not worth it to eat some of these things. However, it sounds to me like you've actually added and introduced a ton of other food you don't normally eat.
Yes.
If there was someone that was on the fence about just even clicking a button to watch our training right now, what would you say to them? A person who's like, right now, they're like deciding, should I push this button to watch this training? What would you say to them?
If you guys are hesitant like I was at the very beginning, I took that leap of faith. I have no regrets whatsoever of the program because it really works. And I'm a person who's really hesitant to join any kind of program for that matter. So it works.
Thank you.
Works for me.
Thank you.
You're welcome.
Boy, that was an amazing interview. And what I think was most poignant about what Katrina shared is that even as a nurse and myself as a doctor dealing with autoimmunity, it really is very limited what the conventional regular medical system has for us and our patients, right? It's really just medication and procedures, and they sometimes can work, but only so far. And it's fascinating to me that even as a nurse and as a doctor myself, we had to learn our way out of this problem. It's not something that's taught even to medical practitioners. So I loved watching her journey with this. If you know somebody that could benefit from watching this video, either because they're dealing with celiac, degenerative joint disease, GERD, or they're a medical professional or a regular person struggling with autoimmunity, sharing's caring. So if you can tag their name, just put their name at the bottom of this video, they'll get to see it. So sharing's caring. They may not listen to you, but they might listen to me, or they might listen to Katrina. Thanks for watching, everybody.